So mandible reduction is a procedure where we're basically making the jaw region smaller. And usually when we talk about the dimensions of the jaw, we're talking about both the width as well as how far this angle extends out. And so it's width and reduction of the angle itself. What we usually do with patients with wide and very prominent angle is that we make an incision from inside the mouth to free up this entire mandible region, and we are essentially cutting out a triangular piece across that angle of the mandible to reduce both the width and the protrusion of that angle. For a lot of patients, we can make a significant difference. The only limitation as to how much we can remove is where a specific nerve is. And that we determine preoperatively by using x-rays. But it is an elegant way of really reducing another feature of the face that sometimes makes the patient's face look too large. The recovery time for a procedure like this is usually about 2 to 3 weeks. Not a whole lot of pain associated with this, but because the incision is inside the mouth, we do ask patients to use a special mouthwash to kind of take care of the inside of the mouth. We also ask patients to wear a special garment that gives a compression across the jawline to give it more definition and to reduce the swelling quicker.